Good day everyone, I'm Yvonn Jay L Guleng and I'm going to discuss Beta-Lactam Antibiotics. Beta-Lactam antibiotics are a class of broad-spectrum antibiotics consisting of all antibiotic agents that contain the beta-lactam ring in their molecular structures. This includes penicillin derivatives, cephalosporins, monobactams, and carbapenems. Most beta-lactam antibiotics work by inhibiting cell wall biosynthesis in the bacterial organism and the most widely used group of antibiotics. The first beta-lactam antibiotics I'm going to discuss is the penicillin. Penicillin was originally discovered by Sir Alexander Fleming in the filtrate of culture medium of mold Penicillium notatum having bactericidal action on Staphylococci in 1929. Penicillin chrysogenum, a mutant of Penicillium notatum, is presently used for commercial production of the antibiotic. Penicillin was the first antibiotic to be used clinically in 1941, signaling commencement of golden era in chemotherapy. The basic structure of penicillin comprises of a thiazolidine ring connected to a beta-lactam ring, to which a side chain is attached through the amide linkage. Cleavage of the beta-lactam ring destroys the antibiotic activity. Amidase cleavage of the amide bond side chain yields the 6-aminopenicillanic acid or the 6-APA nucleus used in producing semisynthetic penicillin. Its mechanism of action is that penicillin bind to and inhibit the transpeptidase involved in the cross-linking of the bacterial cell wall, the third and the final step in cell wall synthesis. The weakened cell wall ruptures, resulting in the lysis and cell death. Penicillin also inhibits other peptidases involved in the cell wall synthesis and block the inhibition of the autolysins. Rapidly growing bacteria are the most susceptible to the bactericidal effect of the penicillin. The penicillin are primarily effective against gram-positive aerobes and anaerobes. The broad-spectrum semisynthetic penicillins are also effective against some gram-negative pathogens. Its therapeutic uses is categorized into 4 categories. First, we have the natural penicillins, which include the penicillin G and the penicillin V. Next category is the penicillinase-resistant penicillins, which include the methicillin, oxacillin, and cloxacillin. The third category is the broad-spectrum penicillin, which includes antibiotic like aminopenicillin such as ampicillin and amoxicillin. Next is the carbapenicillin and the tecarcillin that have anti-pseudomonal actions when used alone or in combination with gentamicin and turbamycin, and useful for ear and skin infection in dogs caused by Pseudomonas species. Next is the piperacillin, cause limits its use to the treatment of severe gram-negative bacterial infection in dogs and cats. Last category is the potentiated penicillins like clavulanic acid and sulbactam. The clinical uses of penicillin are used in the treatment of local and systemic infections caused by the sensitive bacteria. Penicillin G is of value in the treatment of bovine mastitis, primarily in streptococcal mastitis, anthrax, erythropoietic infection in sheep, pigs and birds, strangles in horses, clostridial infections like tetanus and black quarter, pyelonephritis and lumpy jaw in cattle, beta-hemolytic streptococcal infection in puppies, and meningococcal meningitis, and in leptospirosis. Adverse effects of penicillins are allergic reaction, especially in cattle. Signs include skin eruptions, angioedema, and anaphylaxis. Also, hyperkalemia and cardiac arrhythmias may result from intravenous administration of potassium penicillin in all species. And that ends my topic on the beta-lactam antibiotics, especially antibiotic penicillin. Thank you for watching. Bye!